I'm going to speak freely for a second. I think part of what makes healthcare such a challenging beast is that it's not simplistic. I think a lot of what we talk about from the government is that we liberated weather data and it was easy to, well, not easy, but it was, you could turn that information into digestible stuff that created, weather.com and apps, and the same for traffic and geographic information. But if you look at the full patient profile, it's more than just health data. It's financial information, it's what they're spending, it's where they're going, it's where they live. And the organization I'm about to introduce next is, getting on that path of understanding the patient and the consumer from a full profile. Chris Hogg works at a company called 100+. He founded it, actually. And they use all sorts of clever data sources to try to create a more powerful profile of the individual. To give you an example of this, Chris went to the mother of all conferences, South by Southwest, and they debuted a fun app called 100 Proof Me, where they analyzed drinking behavior at this conference, and they found out that the average 20-year-old consumes 5.7 beverages or libations per day at South by Southwest, and they took CDC data, and they took drinking behavior information and figured all this stuff out. So now they're coming up with a new app called Outside, where they're trying to tackle the obesity and, more importantly, the physical activity problem. Looking at this as a multi-headed beast, how do you get people to lose weight and more importantly become more active? And instead of saying go run 6 miles, they're saying go run to Union Square and we'll have people around you and you can see who else is doing this. And they're approaching it from a number of different angles. So I'll let Chris talk more about this. I think you'll enjoy his presentation. So, Chris, where are you? Let's give Chris a hand. Okay.
So thanks a lot. My name is Chris Hogg. I'm the co-founder and CEO of 100+. We were founded in October of 2011, and I co-founded the company with Ryan Howard, who's the founder and CEO of Practice Fusion. And we were excited about a series of trends that we saw that a lot of people here are trying to capitalize on. But for all of us who have been in healthcare for a long time, this is a really exciting time because there's this incredible convergence happening of data that's being dumped out by the government, as well as EMRs like Practice Fusion, and data that we're generating from our bodies from passive sources like sensors. And then these great computers that we carry around with us all the time that know our location, and they know our friends, and they know a lot about us. They even, if you talk to our friends Ginger.io, they even might know your mood. And then groups of passionate users that are starting to get together to try to learn more about their bodies and their health using these data sources. So our goal is to create an experience for consumers that's engaging. So we want to use these tools and data and design to engage people with their health, which we think is the only way to actually make people healthier. If we can't create a product that is fun and engaging and pretty to use, then we can't expect users to use it for a long time, and we won't be able to have a meaningful impact on them. So with 100+, we're starting to use data from multiple sources and trying to mash it up. We use data from Practice Fusion. We also use a lot of data from the government, from CDC. We're big users of Burfus and NHANES. And then we're using user data that we collect by simply asking questions. You'd be amazed what you can learn about somebody by asking them, and also integrating with passive forms of data like sensors. And our goal with 100+ isn't to create a really data-heavy app. We really just want to use the data to create a magic experience. We want to use data for personalization and for recommendations and for feedback. And more importantly, one of the things that we want to start doing with the data is once we learn about your behaviors and create a behavioral profile, we can start to create a forecast or a prediction of where you're going to end up. And we want to start to understand, are your current behaviors leading you down the path of ending up like the healthy grandpa who golfs or runs and plays with his grandkids, or the more unhealthy grandpa who's more sedentary and has a lower quality of life? And we also wanted to understand the impact of behaviors on your quantity of life, so we created the life score. And so when we learn about a user's behavior, every time we learn about the behavior, we've modeled it, and we both increase the life score and change the trend line that we plot people on. And that way we can start to show people the impact of changes that they might make. So as an example, we want to create an app, which will be one of our first products later this fall, that is based on a stream of data, say activity stream data. But what if we were able to create an experience on top of that data stream that made it more engaging? What if we asked questions and we learned a little bit about these users so that we knew a bit about your behaviors and also who you were most similar to? And then we use that information to recommend small actions that you might do in your daily life to be more active, that were appropriate to you based on level of effort, but also location. Or what if we were able to show you activities or healthy things that people had done around you that were filtered either by people just like you or by your friends, things that might inspire you or give you an idea of something you might do. And then what if we were to keep score of all of these small things and show you over time how these small little actions actually do add up and they compound essentially like interests. So with 100 Plus, we want to learn about and analyze and score current behaviors, and we also want to recommend actions and get users to tell us what they did. And that's obviously very complicated, so we broke it up into 2 pieces and have run 2 experiments, and these are the products that I'm going to show and demo today. So our first experiment we put out in March at South by Southwest, and as you know, South by Southwest is a very fun, it's a party, and we are interested in analyzing behavior, so we analyzed drinking behavior. And we learned some really interesting things. We analyzed drinking behavior from over 300,000 people from CDC Burfus, and just interesting things like that people, as people age, they tend to drink more often, but they drink much more moderately. So the blue line is number of times people drink within a month. It goes from 6 times a month to 12 times a month as people age. But people stop binge drinking. They stop drinking more than 1 or 2 drinks as they age. We also found that no matter how we really looked at it, moderate drinkers seem to do better. And we also looked in other published literature and found a similar studies. This is based on self-reported health. And moderate drinkers did better than obviously heavy drinkers, but also better than non-drinkers. And of course, this is correlation data. And we don't know the reason for it. We have some ideas, but we're actually very interested in correlation data and think that it can be really valuable if used appropriately and handled with care. But one thing we did find is that non-drinkers actually exercise a lot less than drinkers, and it's a linear relationship. The more people drink on average, the more they exercise. And moderate drinkers are also more social, which tends to be healthy as well. So we use this basis, this understanding of these behaviors to try to create an experience. And so we created a quiz that we put out at South by Southwest that essentially we start by asking users, how many drinks did you have last night? And all enters 5, which is actually about the average that we collected, and then showed people feedback. So we use data here for feedback. We use data from CDC to show national average as well as South by Southwest average, and try to show people how they compared to people like them. Then we asked what types of drinks that they had, and again showed them instant feedback. And then we asked some personal questions like gender and age and weight. And what we found here was very interesting. We ended up getting about 7,000 people through the experiment in 2 days, and we lost very few people through this point. So on any given screen, we lost less than 1.5% of people, even when we asked things personal like weight. And we think that it's because we provided feedback, data-driven feedback that showed people a little bit of a mirror about their behaviors. And also we tried to make the data input really pretty and friendly. And we also collected a lot of data out of the app. We actually tracked about 37,000 drinks. We found out that iPhone users drink a lot more than Android users. Men drink more than women. 20-year-olds drink a lot, 5.7 drinks on average. And we tracked over 5 million calories ingested. But what we didn't do with the South by Southwest app was get people to actually change their behavior or do anything. And so what we wanted to do with Outside, which we're showing here for the first time, is we wanted to create an experience where we tried to get people to do small little healthy behaviors and then reinforce why those behaviors were good for them. So we created a photo-based scavenger hunt of small healthy behaviors. So again, we started by analyzing data. What can we tell about different behaviors? And so here, this is again data from CDC that we analyzed, looking at just some random things like how much people eat potatoes or salads or carrots or exercise, with people in very poor health on the left and people in excellent health on the right, and that's a health index that we created. And the most impactful, obviously, was exercise, where there's actually a 7-fold difference between people who are in very poor health and people in excellent health in minutes they exercise per week. And that helped us define little missions and how many points we should give for each mission when people completed them. And so again, we wanted to create a fun experience. So we created these little missions that people can complete, little things like take 2 flights of stairs or eat at a farmer's market or eat a salad with 3 colors in it. And we created Outside. So we have the missions page. We also can show people a leaderboard of how other people are completing missions and how their friends are completing missions. And then we wanted people to document that they had done something by using a photograph. And we think photos are really a powerful way of expression and a way to celebrate these small little healthy wins. And then we show also on a map so you can see what people are doing right around you. And here's the missions page where you can see some of our missions like eat some carrots. And when somebody takes a photograph and tells us that they've done that, we give them feedback, data-driven feedback that, hey, did you know that people in excellent health eat carrots every other day on average? So some fact that's tailored to the mission that they just completed. And then we show them how other people have, or what other people have done in the form of photographs. And the goal here is to try to create a system where people are actually doing little things and reporting back to us, but where it's all a value-added experience. It's actually a fun part of the experience and not a tax. And we're really interested in the concept of using photos to document these little healthy wins. And the goal then is to think of, well, what if you told me what you did, and I could show people like you things that you had done so that they can be inspired by what you have done and maybe replicate it. So what I wanted, since a picture is obviously worth 1,000 words, a video is probably worth 1,000,000. And so we wanted to demonstrate, we try to make things fun and engaging and a little exciting. So we wanted to create a video that demoed our 2 apps. So here's a little 2-minute video that we created. So we just want to remind you that health can be fun, and health can be exciting, and health can be playful. So thank you very much. We're 100 Plus. No questions? Thank you. Thank you very much.
Thanks. Cool stuff.